Hello, everyone. My name is Christopher Rodman. I have a background working in inpatient clinical psychology with individuals with substance use disorders, working on Capitol Hill shaping opioid policy, and I now work at CPWR, the Center for Construction Research and Training, on their opioid and mental health related projects. I'm going to be talking today about how construction workers are more likely to die of an opioid overdose, discuss some of the reasons construction workers are at risk, talk about some work-based solutions to the problem, and share some of CPWR's resources with you. So first, what is the problem? Well, we are in an epidemic where more than 69,000 people died of an opioid-related overdose in the year 2020. This number is nearly 19,000 more than died in 2019. Unfortunately, construction workers seem to be at higher risk for opioid overdose. Separate studies in both Massachusetts and Ohio have shown that construction workers were about 7 times more likely to die of an opioid-related overdose than other workers. So why do we think construction workers are at higher risk? Well, first, studies show that over 1/3 of construction workers report high rates of chronic back pain, and in workers over 50, this number is even higher. We know that construction workers do experience injuries. And a recent study from CPWR showed not only that workers with an injury are more likely to be prescribed an opioid, but that injuries appear to be undercounted. There is a desire to get people back to work as quickly as possible after an injury by eliminating the pain of the injury. And when a construction worker goes to the doctor, studies show they are more likely to receive an opioid compared to another worker, even for the same type of injury. So we know this is an industry where high risk for pain and injuries equals high risk for opioid painkillers. Health insurance and doctors are willing to write scripts for opioids, and unfortunately, pharma companies even marketed opioids directly to construction workers while playing down the risks and exaggerating the benefits. Finally, the boom-bust cycles in construction work can contribute to this because we have long days of work, many weeks of work without enough rest time or sick days, which can exacerbate old injuries or make new ones harder to heal. So let's talk about some solutions. There are 3 levels of prevention in the public health model. Today, we will mostly talk about the first 2. First, you deserve to work in a safe environment. Reducing and eliminating the risk factors, including tasks or conditions that cause pain, is the first line of defense. Level 2 preventions include the care a worker receives when injured. We encourage talking to your doctor about non-opioid interventions that can be used in the case of an injury or pain. Lastly, there are many workers out there who are already dependent on opioids. They need help, and medical intervention is the best way to go. So, in regards to level 1 prevention, what are some examples of ways to prevent painful injuries on construction job sites? Well, these include ergonomically designed tools. We need safety and health committees to identify and address hazards. Hazards need to be reported. We need to prevent slips, trips, and falls. And we need an overall positive safety culture and program. Finally, we need ergonomics, which means fitting the tasks of the worker to prevent musculoskeletal disorder injuries. This can include lifts or assists that are designed to reduce mechanical stress on the worker. Level 2 prevention includes appropriate non-opioid care for individuals. Studies show that opioids aren't effective painkillers for long-term chronic pain. The bottom line is that this is a medical issue. There is strong evidence that physical therapy and steroid injections are more effective than opioids for controlling chronic pain. It has been shown that opioids didn't work as well as Tylenol and ibuprofen in studies that looked at dental pain, pain after accidents, post-surgical pain, severe pain from kidney stones, back pain, and chronic pain. And of course, we know that they cause tremendous harm. Let's talk a little bit about who gets addicted. Unfortunately, it is anyone who takes opioids, whether they are legal or illicit. The graph to the right shows that the longer the initial prescription for opioids, the higher the chance someone has of being on them for an extended period of time. This risk starts as little as 4 to 5 days, but as you can see, there is a very steep jump after 10 days. It is important to note that addiction refers to the negative behaviors that one engages in to gain access to opioids in order to get high or to avoid withdrawal. For individuals who have long-term prescriptions, they are dependent because they would go into withdrawal if the prescription were stopped. At this point, they would be at a great risk for addiction because if their physician stopped them without slowly weaning them off the drug, they would immediately experience withdrawal symptoms. Now they are more likely to illegally obtain opioids, and the relief one gets from stopping the withdrawal symptoms is such a powerful reward that dependence can easily turn into addiction. The bottom line is that exposure equals greater risk. So let's talk about some of our resources. If you would please go to CPWR.com and search opioids, the first hit will be our opioids resource page. These include a toolbox talk, key findings from research, a hazard alert, a physician's alert, data reports, and links to our opioid awareness program. Finally, if you Google SAMHSA Treatment Finder, you will see pages for the SAMHSA helpline, and a very useful treatment finder tool that can be searched by geographic location, level of treatment needed, and by your insurance provider's coverage. Thank you so much for your attendance today. I'm happy to answer any questions you may have or to guide you through our resources. Please feel free to contact me via email. And finally, we are here at CPWR, we are currently piloting a mental health training for apprentices. And if anyone has any interest in hearing more about that or would like to be part of the pilot, please feel free to contact me as well. Thanks so much, and I really appreciate the opportunity to be here.